Hi, my name is Frank Romano, and I'm doing a refutation on Ms. Marissa Benjamin's argument that active euthanasia fails to provide what passive euthanasia provides. Her first argument is that she argues that passive euthanasia, which is withholding the use of medical treatment, does not prolong or end the suffering of a patient. My response to her first claim is that withholding treatment from terminally ill patients is sufficient enough in order to establish reasonable control of the patient's life. This is shown by the Stockholm Hospital reported. A 32-year-old woman who was completely paralyzed and had been on life support since she was 6 died on Wednesday after her respirator was unplugged. In Sweden, the first case of euthanasia. Now, when a woman who was 32 years old and was alive on life support for over 25 years, and instantaneously when passive euthanasia was put into effect, she passed away. In response to her evidence for her first claim, she responded saying that doctors advocate active euthanasia. Doctors do not advocate active euthanasia. In Hong Kong, the medical council issued a guideline relating to the withholding or withdrawing of a life-sustaining treatment. According to the guideline, doctors may terminate futile treatment on a patient upon consulting with the patient's family. The mass media reported this was an implementation of passive euthanasia. The Hospital Authority and Secretary of Health and Welfare both immediately disagreed, saying that passive euthanasia is unacceptable. On the other hand, it can be acceptable. Mass media has been accused of misinterpreting the position of the medical council. Now, this is simply showing that hospitals in Asia are willing to permit passive euthanasia, and the doctors are advocates of it, but the government itself is trying to fight it, saying that it's not constitutional under the Chinese constitution. Marissa's second argument is that she continues to argue with Karen Ann Quinlan case, which is where she survived for comatose in her bed for 9 years. She then begins to defend her active euthanasia is not a slippery slope for legalized murder. I believe that active euthanasia will lead to legal murder. Since doctors, it's shown by the ethics guideline given to the United States, I forget exactly, I'm sorry. Since doctors give patients the information on which they will base their decisions about euthanasia, any legalization of euthanasia, no matter how strictly regulated, puts doctors in an unacceptable position of power. Doctors sign an oath, and doctors are not allowed to take the life of a person. Plain and simply, to be a doctor, to be a medical doctor, you have to sign this oath. So by us legalizing and saying active euthanasia is plausible and should be legal, therefore, that will get rid of the medical doctor field. In response to her reasoning on the slippery slope, active euthanasia will create a question of the right of suicide or assisted suicide. Dr. Ian Downbiggin, PhD, writes in his 2003 book, A Merciful End. The talk of the right to die raises the troubling questions. Once legalized for the dying, who could be denied such a right? The chronically ill, but not dying, pain-free patients who nonetheless feel their medical conditions leave them with no quality of life. Someone would have broken that. Depressed teenagers, mentally ill, handicapped children whose parents wish them dead, infants with severe disabilities. Where does the freedom to die end and the duty to die begins? On her third claim, her last argument is that the autonomy of a patient. Autonomy is the right of self-governance. I believe that active euthanasia actually gets rid of the autonomy of a patient due to the fact that you are putting your life in the hands of a medical doctor. Medically, a doctor has to actively inject a poison into you to kill you for active euthanasia. How is that autonomous in any way, shape, or form? I believe that active euthanasia is unconstitutional. Posted on the ethics guide, the Supreme Court case in 1998 also rejected an argument that a state which prohibited assisted suicide, but which allowed termination of medical treatment resulting in the death unreasonably discriminated against the terminally ill in violation of the Equal Protection Clause of the 14th Amendment. With that, I'll leave you with this very simple statement. Euthanasia. It's a long word. It sounds nice. It's quite pretty. But with like a lot of words that are very nice sounding, it hides a lot of the meaning.
All right, I thought you labeled the main claim very clearly, and each of the supporting claims, as you got to it, you did a pretty good job labeling them as well. There's not really any discussion of the advocate's evidence in your argument or their reasoning process, so there's not much refutation going on. We've got mostly rebuttal arguments, which are challenging and presenting counterclaims on those issues. They're pretty good counterclaims that you present about the doctor, that they become dependent on the doctor's decision, that it's going to lead to a greater number of these kinds of slippery slope cases where it leads to murder, and you've got that whole evidence about the duty to die. I think that introduces a reasonable counterclaim argument on that point. I think what you need to do is explain and contrast that point to the point that the advocate was making. You basically just present the counterclaim without explaining how it responds to the advocate's claim. And it might not be as big a deal if we had heard the advocate just 5 or 10 minutes ago, and now you're getting up to respond. It has been a little bit of time, so I think we need some additional contrast from you. And like I said, I thought that the internal signposts were pretty clear as well. All right, thank you.